Artificial Intelligence Dr. www.abcpharma.net/English. User question: what are the potential impacts of viral upper respiratory infections on the function and performance of unicameral leadless pacemakers in elderly patients? And how can these be monitored and managed? Claude AI. The potential impacts of viral upper respiratory infections on the function and performance of unicameral leadless pacemakers in elderly patients are complex and multifaceted. Here's a detailed explanation of these impacts and how they can be monitored and managed. 1. Inflammatory response and myocardial function. Viral upper respiratory infections, such as influenza, can trigger a systemic inflammatory response, which may have direct effects on the myocardium. The release of pro-inflammatory cytokines, such as IL-1 beta, TNF-alpha, and IL-6, can lead to myocardial inflammation, or myocarditis, which can impair cardiac contractility and electrical conduction. In elderly patients with unicameral leadless pacemakers, this inflammation-induced myocardial dysfunction may alter the pacing thresholds and lead to changes in the pacemaker's performance. Monitoring of pacemaker function, including pacing thresholds, impedance, and battery status, should be performed regularly during and after the acute infection to detect any changes that may require adjustments to the pacing parameters. 2. Autonomic nervous system dysregulation. Viral upper respiratory infections can also cause dysregulation of the autonomic nervous system, leading to an imbalance between the sympathetic and parasympathetic tone. This autonomic imbalance can manifest as sinus tachycardia, bradycardia, or other arrhythmias, which may affect the sensing and pacing functions of the unicameral leadless pacemaker. In some cases, the pacemaker may inappropriately detect the altered heart rate as a native rhythm, leading to unnecessary pacing or mode switches. Close monitoring of heart rate variability and pacemaker activity during the acute infection can help identify any autonomic disturbances and guide the adjustment of pacing modes or parameters to maintain appropriate pacemaker function. 3. Respiratory effects and pacemaker dislodgement. Severe coughing and increased respiratory effort associated with viral upper respiratory infections can potentially cause mechanical dislodgement of the unicameral leadless pacemaker. Although the risk of dislodgement is relatively low due to the small size and secure fixation of leadless pacemakers, it remains a potential complication, particularly in elderly patients with frail or weakened cardiac tissue. Dislodgement can lead to loss of pacing function, pacemaker migration, or perforation of cardiac structures, which may require urgent medical attention and intervention. Regular follow-up with chest radiography or echocardiography can help assess the position and stability of the leadless pacemaker, especially if the patient experiences persistent cough or sudden changes in pacemaker function. 4. Pharmacological interactions. The management of viral upper respiratory infections in elderly patients often involves the use of medications, such as acetaminophen for symptom relief, or antiviral agents like oseltamivir for influenza. Some of these medications may have potential interactions with the pacemaker function, either by altering the pacing thresholds or interfering with the sensing capabilities. For example, high doses of acetaminophen have been reported to cause transient changes in pacemaker function, although the clinical significance of these changes is not well established. Careful review of the patient's medication list and close monitoring of pacemaker function during treatment can help identify any potential drug-device interactions and guide the selection of appropriate therapeutic agents. To effectively monitor and manage the potential impacts of viral upper respiratory infections on unicameral leadless pacemakers in elderly patients, a multidisciplinary approach involving the collaboration of cardiologists, electrophysiologists, and infectious disease specialists is essential. Regular follow-up, remote monitoring, and patient education on the signs and symptoms of pacemaker dysfunction can help ensure the early detection and timely management of any complications arising from the interaction between the infection and the pacemaker.